I'm Dr. Dan Horvat, a family physician in Northern BC. I'm also co-lead along with Dr. Paul Winwood of Northern Partners in Care, a shared care initiative. And I'm an assistant professor with the Northern Medical Program. It's part of the Department of Family Practice, UBC Faculty of Medicine. So RACE is the Rapid Access to Consultative Expertise line, which we've set up as part of Northern Partners in Care. It allows family physicians to be able to call if they're seeing a patient in the office and they're not quite sure how to handle it. It's not an emergency, but they want to have a specialist kind of help them in terms of guiding the care. So they can call the RACE line, and we've got a number of specialties involved so far: cardiology, soon nephrology, and then we've got a number of other ones kind of lined up that are interested. And it allows the family physician to be able to get the expertise that they need kind of at the time or close to the time that they're actually seeing the patient. So RACE went through its first iteration of being a bit too cumbersome. We had forms that we were relying upon, and often it was difficult for people to know where the forms were, etc. So we're relaunching RACE as a far more simplified kind of version where the family doc basically picks up the phone and calls to get access to the specialist. It'll be far simpler than it has been in the past, and so it'll be far more usable. Plus, we're going to be getting the information out to family physicians better, as well as adding further services to the RACE line. The RACE work that we're doing builds on the great work that's been done at Providence. So they've got a RACE line up and running. It's been there for a while. They've got, I think, a dozen different specialties involved with it, and we may tap into some of the specialties that they have on their RACE line that we don't have access to in Northern BC. So it's a really neat kind of capability that we're developing and that's already been developed out of Providence and Vancouver. So RACE down the road, we look at it as helping family physicians to access specialist service across Northern BC, from across Northern BC. We are running right now with cardiology, adding nephrology soon, and a range of specialties that are interested in engaging as well. So I would see that we'll have a kind of 1-800 number that family physicians can call, make it easy for them to be able to remember that number and call to be able to get the kind of support that they need to deal with complex patients in their practice.